It's a very different welcome at Northwick Park Hospital these days.
Would you like to come in, sir?
Thank you.
Temperatures are checked, hands are sanitised and masks are worn everywhere. This hospital was at the heart of the coronavirus outbreak, at one stage early on having to declare a critical incident and ferry Covid patients elsewhere. Staff here were pushed to their limits. For more than 3 months on, there have been happier stories too, like the one of A&E nurse Franco Parlo.
I love you all, thank you very much.
A patient here for more than 9 weeks, critically ill with Covid, but finally able to leave.
Excited to go home now, and it's time to see my family, get my life back again. And I thank God and all the people that have prayed for me and supported me and my family.
They're starting too to try and get back to as normal as possible, starting routine day surgery, starting to tackle a backlog of patients.
Patients have been completely extraordinary in their response to all of this, understanding that we couldn't do what we wanted to for them and so on. You know, the number of angry phone calls I got during the Covid real peak to say where the heck is my operation was exactly 0, you know, which was remarkable, particularly given that some of them suffer a very great deal.
Brent is one of London's most diverse boroughs and has some of its poorest areas. Both are key factors in Covid infections. Nearly 500 people have died, 1,700 have tested positive for the virus. And when you take into account the young age of the population here, Brent has the worst death rate of anywhere in the country.
There are lots of reasons why it's an interesting place to work. You know, we have a very diverse staff who come from those areas as well. So, you know, our staff feel that they're serving, you know, the patients from their own home areas, and we're extremely keen to work with them to work out why some people have been, you know, harder hit, and see what we can do to minimise the impact of that.
The A&E is back at about 80% of usual capacity, but there are new ways of working, green zones that are Covid-free. At the height of the Covid outbreak, nearly all of these, apart from 3 or 4 of these cubicles, were red, treating Covid patients. So a sign there of things changing. And if you come around here, you can see another sign of change, a temporary barrier here at the moment, but they are going to put permanent doors in to make that separation between the clean and the dirty areas much more clear.
And since the real peak of Covid stopped, we've just carried on trying to catch up. And we could really use a holiday. A bit of time to catch our breath and regain our strength. There isn't really scope for that at the moment. We're just pushing on.
Karl Mercer, BBC London in Brent.